good evening from wherever you might be watching us from or catching our signals. If you're following us online and probably on radio as well, you're welcome to this special broadcast that is brought to you courtesy of the Ministry of Health and Partners. I am Ansmane Sonyasi and I'll be your host for this program this evening. And joining me here in the studio is Mr. Omar Jaite, who is a Health Communications Officer at the Ministry of Health. Mr. Jaite, good evening and welcome to the program.
Thank you very much, Mr. Nyasi. Thank you.
We're happy to have you here. Now, as you may be aware, viewers, COVID-19 has been around since December of 2019 and is still on. The Ministry of Health, government and other agencies as well as partners have, put up strategies and mobilized resources, as well as even vaccines as well, with the coming of the vaccines. So all of us can stay safe and, so we will return back to normalcy.
Yeah.
However, like I said, COVID is still around and the ministry is not relenting in its efforts to ensure that, we resume, our normal lives. And to that end, Mr. Jaite here, hopefully we'll have another officer from the ministry join us as we progress in this program to tell us what the ministry has been doing. Of course, take us through COVID-19 as well and its impact. But Mr. Jaite, could you give us just a general view of what our current COVID situation is?
Okay. Basically, COVID-19 is on an increase as we speak, because usually
that's quite alarming.
Yeah, it is because it is on an increase. Sometimes has passed, we'll see 2, 3, 4 sit reps without a case, but now in a sit rep we see above 30 cases. So it is alarming. In fact, today we are seeing so many cases, although they are yet to be reported, but cases are presently alarming and they are increasing per se.
When you say sit rep, could you break it down for us?
Yes, sit rep is a shortcut of the situational report. Yes, that the Ministry of Health usually give to update the public about the situation of the COVID in the country.
I say it's quite alarming because people have been, members of the public, I would say, have been pretty much relaxed when it comes to adhering to the COVID guidelines nowadays, and the fact that you just mentioned that the cases are on the rise. I'm thinking we have cases still on the rise, and we are not really very much serious with adhering to these rules.
Yes. Maybe, in fact, maybe that might be one of the reasons that we are seeing cases jumping. And in fact, those who we are testing, most of them are travelers. So the good number of public are not testing. So it sends a signal that COVID is still around and is presently increasing among the population, although they are not still testing. So that is why the Ministry of Health they are concentrating more on to give vaccines to the public.
Talking about people not testing and also not adhering to these COVID guidelines. I think a few days ago, was it day before yesterday? Or was it yesterday? I was at the ministry, at the medical center in Kotu.
Yes.
And we were made to understand that of the 70% population target that the ministry had set, only 18.5% are so far taken the vaccines.
Yes.
That's really very. It's far from
the 70 years.
From the 70.
Yes.
18
so
is quite
18
low.
18 is quite low. So that is why the ministry is still pushing. Then we can say we don't have enough vaccines, but now vaccines are available. So that vaccine hesitancy is a very big issue that the ministry is facing. People are not coming out to get vaccination. I think this is our fourth campaign in vaccine, our fourth COVID vaccination campaign that the ministry is embarking. So we are urging the public, everyone, that vaccines are available, they are safe. And in fact, we are giving it up to 12 years. We have 3 vaccines. We have Pfizer, it is available. We have Johnson & Johnson, it is available. And we also have Sinopharm. These are all 3 very safe and effective vaccines that are available for people to take. Because that 70% is a benchmark that the WHO has set. Countries are struggling to reach to that. I think in Africa, I don't know, 2 or 3 countries were able to get to that. That is Mauritius and and Seychelles, very small islands. So the Gambia is also trying, although we are somehow back if we compare ourselves to other countries, but we are trying to reach that 70%. That 70% is what, if the ministry was able to reach that, it will help us to have that herd immunity in the community, that herd immunity that will even protect that 30% that was not able to get the vaccines.
Earlier you mentioned vaccine hesitancy. Could it be that, you know, some of these misconceptions we had from the start,
yes,
you know, that were being bandied around by people, especially online, regarding vaccine efficacy, vaccine safety. Could these be contributing factors as well?
Yes, it could be. It could be, because these rumors and this misinformation, in fact, they precede the vaccines. Because before these vaccines arrive, the misinformation has already arrived. We call it infodemic. It is all around. People are saying that if you take the vaccines, you will die. I even saw a video that if you take the vaccine, if you put a mobile phone at your arm, it will stick there. So now people should be out.
I took 2 jabs, but I'm still fine since last year. So.
Yeah, so the same with me. So this information, I think people should know that now they are all not true, because I have taken vaccines, I have not died, I have taken vaccine, no mobile phone has stitched on me. So some of these informations are what public that confuse the public. But I'm sure now most of the public know that the information are not true. The only thing is, especially the youths, they think that COVID is not their business.
Yeah.
Yes, COVID, there's nothing that COVID can do to them. Even if they have COVID, it will just go off. But the youth should know that they are living in compounds. They are living with their family members, which might be one of those vulnerable groups. Yes, that can be very vulnerable and at a high risk of getting COVID.
Well, we have seen even some of the biggest economies struggling, you know, to come to terms with the impact of COVID. And
Exactly.
we're still living with the impact of the pandemic. And, you know, I hope that people would really take it up upon themselves to protect themselves by taking the vaccines and also, I mean, adhering to the COVID guidelines. Right. But again, the ministry is rolling out another nationwide vaccination campaign. Take us through it.
Yes, the vaccination campaign has started on on Thursday. We have started it on Thursday, so it's like the orders. So we have teams around the country. So they will be going from community to community. They will be going from street to street. So they will be coming to your end. You will see them around your end, especially the students, because our last vaccination campaign, we are able to get so many students to get vaccinated. So now that most schools are closed, so we are still advising students that that the same team will be coming to our end. So let them go and get their second jab so that they can have that full protection from the vaccine that the vaccine will be able to give them.
Talking about the jabs, who is eligible to take the jabs?
Yes, you have Pfizer that even 12 years olds can take. 12 years above, they can take the vaccines. We have Johnson & Johnson that 18 above, Johnson & Johnson and Sinopharm. Those ones 18 above can take. But even adults, if you want a Pfizer, all the 3 vaccines are there, so you can take the one you prefer among those ones. So it's 18 above. All of them are targets, and especially those who are yet to be vaccinated, because now you have been receiving calls that most people are inquiring about boosters. Yes, we are not restricting boosters. Yeah. If you want a booster, yes, you can go. They will give you a booster, but our main target is those who are yet to get these vaccines.
All right. So how about the issue of you know, how do you call it again? People that take the jabs and then, you know, they're having to deal with it's
side effects.
You know, the side effects.
Yes.
Could you allay people's fears as well around that?
Yes,
I know there's a lot of misconception around it too.
You know, these are pharmacological interventions. So side effects are usually expected.
Okay.
But
it's normal.
Yes, it's normal, we call it. But usually they are mild. Okay. They are mild. You might feel some headaches. You might feel some
dizziness?
Yes, dizziness is somehow rare. But yes, you might feel some pain, and where you get the vaccines. Some headaches, some fever, but 1, 2, 3 days they will go off. In very rare cases, in very rare circumstances, you can have some allergic reactions that we usually call it anaphylactic reactions. They are quite dangerous, but our health teams, they are trained to handle. Yes, they are trained to handle those cases, but it's 1 in a million, so it is very rare.
Okay.
Yeah, it is very rare. It is very rare. So these vaccines, they have been tested, they have been approved, so they are safe, because almost more than 7 billion doses has been given around the world.
Yeah.
So if these vaccines, if it is if it has a major effects, major impacts on people's health, that will have been exposed by now.
Absolutely.
But yes, but they are very safe. Yeah, they are very safe.
So this new campaign, how is it going to be done, and where can one get the vaccines?
Yes.
Are they going around homes, in the communities, or there are specific centers or health centers where people go to and get vaccinated?
They will be going around the communities. They will be going to bantabas. They will be going to school, ferry crossing points. They will target places where they will be able to get more people.
Yeah.
But if you wish to go to somewhere that to be sure that you'll get a vaccine, you can go to the nearest government health center at your end. You'll be able to get a jab there.
Okay.
Yes, you'll be able to get a jab there at the nearest government health facility. You have a very robust team that are going around, and they are doing quite well, because we have been receiving updates that it is progressing. Yeah, and it is progressing well. So we are encouraging Gambians to come out and to take these vaccines, because if you take these vaccines, it's not that you are only protecting yourself.
Yeah. But the people around
yes, you are also protecting people around. You are protecting the grandma there, you are protecting the dad there, you are protecting the auntie there. Because those ones are at risk. Those with diabetes, those with high blood pressure, and other non-communicable diseases, other chronic diseases, they are at very risks of getting COVID.
But it's nationwide, right?
Yeah, it's a nationwide thing. It's a nationwide thing. So it is everywhere in the country. So our teams, they are moving everywhere in the country. So it's a nationwide campaign, and it is going on.
Okay.
Yeah.
So just to, a quick reminder that this program is brought to you courtesy of the Ministry of Health and partners. We're talking about the COVID-19 vaccination, campaign that is being rolled out. Another one again by the Ministry. Earlier I did mention that we're expecting another guest, as we progress in this program, and we're happy to have him, here with us. Good evening, sir, and welcome to the program.
Thank you very much.
All right, so just quickly share your name with us and the institution you're representing.
Yeah, that's good. Good evening, viewers. This is Siddharth Fofana, a National Program Manager responsible for the immunization program.
Because of the mask, I didn't recognize Mr. Fofana. Seriously. But we are happy to have you.
Yes. Thank you very much.
All right. Mr. Jata here was giving us, a rundown of the current COVID situation in the country, and this new COVID, vaccination campaign as well.
Yeah.
But at the level of the ministry too, just quickly, take us through. I was with you. I think it was yesterday.
Exactly.
When you were giving us, data, statistics of how far we've fared as far as the vaccination is concerned.
Exactly.
18.5%, quite low.
Yeah, quite low. And that's the greatest concern we have now, considering the fact that disease is still around. It's coming in waves upon waves. So the only thing is to make sure that we move the whole country to at least 70. There's no reason why we can't go up to 100. Looking at the disease pattern, how dangerous the disease is, and the people usually affected are the very fabric of the society, like elderly people. We need them for advice. We need them for guidance. We need them, a whole lot of things. So if we allow this part of the population to be depleted, then we are even not that. Without reaching that, you can see now economically everybody is affected in the world. Yeah? Because goods international business has been hampered to such an extent that goods cannot reach countries the way they should be, and then the whole world is starving. So that makes it very, very important. A small country like Gambia, if our economy has been crippled to such an extent, we don't have natural resources. So the little natural resources we have is, the people, you and me. So if we should be sick and die of a disease that is preventable, then that is a very serious situation. And I don't think we need to allow that. one thing I'm always happy when you come to infant immunization in this country. The women are excellent. They go to the clinic. The moment somebody is pregnant, he will go, she will go, or the other, siblings will ask, go to the nurse, go to the nurse. And that is why we have very high routine immunization coverage. Even this COVID-19 vaccination, more women have taken the vaccine than men. So what are the men? Our care-seeking behavior among the women is very bad. And that is not a good sign for this country. We should also try to follow the women so that we save ourselves to leave the country as a viable country. We need to move with the international community.
Talking about not good sign, earlier Mr. Jaite gave us some disturbing information that, cases are on the rise.
Yeah, cases are on the rise. And most of the time, those who have already been vaccinated, they have it very mildly. It doesn't disturb them. But the problem is those who are not affected. And we have a lot of them. 18% out of 100 is too much. And as he may rightly told you, many people in this country are having other conditions, terrible conditions. The most common among them are hypertension, diabetes. And the cancers are also rising. So usually those people, if they pick up disease, by the time they realize that disease, they're already gone. So we lose them. That's why government is not resting. Our partners are there all the time to support us, to make sure that at least before the end of the year, we are up to 70%, and we can do it.
Yeah, we can.
If we follow the women folk.
That is the target, December.
Yeah, that's the target. That's the target. So that's the situation.
Okay. Yeah. So, Mr. Jaite, ngaje ko COVID bijan hani saying. Ya fuko ko montron ning angale kamala ko casual fana me rise kan abako be lafa kan ne. Ando ngaje ko jama bi jeme yalon ko saying molbu ko hani COVID guidelines of follow saying, abako casual fana fele abela fala. Ministry fana wulita ye campaign kudo fana fenge ko nge pour mol seta nyim pengota pour ke fana tanka. Just briefly, like, as summarize no campaign ning aning fana mol la COVID situation be nyade.
Okay, baraka bake Mr. Nyasi. Campaign ning start aramis wole. So comme mbe alo nyami ning COVID meta Gambia jande saying asiara sanjoti Abidjan abam fejam. So akanala la faytala but say mbatembo min dafa aba ne epic COVID be sa isa de ko aba la fa kan na demanding. So muka min tandi ko alo la fanying niatara ita wa molle kon mi yalangi vaccinate hana han COVID yeta muta amanta garaw la ko mo mi yalon ko amam vaccino nyinta. So wala tina ministry ila joram bambe wala kella joram bambe bul joram man tambi vaccino la iba min be bul joram wal be bul ila joram ba vaccino temba entembo min wota vaccino man na ministry kam ne ala bul ko al maksud dal ba sa ministry la joram ba minute wala vaccino ti so wala tina ikaje karadantan COVID vaccination campaign na karadantan COVID vaccination campaign na so wala na ministry do start ko tenge aramiso. So ikaje Gambia belo na molba dulal belto Gambia ko iba banta balto iba tara karamol de batara health center to on ibinala la community ko so na leje alla community ko rek aleta alle vaccine ta so modol kaje ko vaccino aman jarante ada because haninga ta amanda ku kelanta ande covid muda amamuda nguma nginda amanda ku kelanta bare ibo da suwal ko o so ko do molle be mi yalon ko sasa dol batado sasa dol satarnu wala hypertension da sarnu dol diabetes sarnu dol so sasa sifa sasa do satarnu mila anu covid na mo muta sasa do taramina amako mari batandi bake so wo kama mbafondin kel fana ya mata bake puru o perception o yo bondi ko ko coming nte han covid mu da problem nte adiamo siara so la fin dia in vaccine ulta comme min bijenu min because covid ala information of real gening vaccine of fankana so information we I am batandi bag but saying information jaa bije akweta mobile ko manga to nyaat because he call ne covid vaccine da ba falale ko ne covid vaccine da ne mobile na pi fango bala
denga tale bar mo
yo so wonde manga so information jama bije saying nyanta karam dal ko dol manga to nyaat so pour mo leta je fin vaccine ta abakumayala ba because ni ata ebe fon tankandira modo fna ka sila foni ata fo kusa kela ni ata sekeno ni ka sekeno ha boro han paracetamol ni amin a side effect ndingo so tale balakandol so boro ni ata balakandol ni le sekeno le isake baliano le balo sakano le ko se dimino yeda penguno je sa dimino le so wol dol dobie abuga tilo fonsi woleta na siar tilki repi wol kata so ila protection o kata re bala ila protection o so comme vaccine wala side effect million ko gara wo million kono so o is amansia at all so wo kamala mba fala mo le vaccine o a safe tale because mo jamala ta gambe jam kumankela so ngatang ngatanu ngam fangol tanka ngan nawulal tanka ngan mamal tanka ngam barngol tanka million ke basu kono ngamobe tanka puru gambia ngam fangol tanka because ngajele na economy boyta nyami amanga gambia dorondi nyin covid ay dunia bela ma sa cool fanga bel falende hani ga tama fa fu ko ila vaccine certificate wala vaccination o tala ba ni mata ka fa da test o test du ka muli fula kemalul le jo pour yo okay adun dol fana wol ka fintina kanje ka fo sama le ka tama bile be vaccine o tala bi ni ata o man na fa because vaccine o ni ata at least ananda ka 12-14 days ke jato kono le jeni ila vaccination card ni ka accept so mol nyanta ka fintile ta ni vaccine o ta vaccine o akumayata ba because sa dunia fo bataka nyami ni man vaccinate ku jama bije ibuka ken o dunia ita katu isa tarno ila so dorna kono so vaccination o kumayata ba
misa bobana misa jete la ma me interest back ni online jibe ni whatsapp ni facebook adia mo si ara mol be fola alkana vaccine o ta ni ata ibe fala ibe sasala to babol kamol le nene ede dum be do ko la ministry ngal ko e fon vaccine o nyintal pour ka mol akilo tenkundi do ko vaccine o nying is safe and fan effective la
very good o kuma ra bak comme en kuku na finda science fo setan no si findi samba setan no si findi simol hakilo jawande comme en dino be nyame ane wo fon amo sifal ka findi jer bare wol mo fene de me alon ko to nyata ko Gambia janga membe pengu mo wuli keme nana ni fam mo klinde me yafo ko ya pengu la afata ni Omar kam fot ni pengu bawo jado lam yelo ni hada badum yelo abe balur ne ko hada badum fanam be balur nyame system wala soto fen dun daje akalo no ko fen na amanke jankode so aka katale ke pour wo sike kude melo ga kana balotora wala na pengo nyin kum mayata ni pengo di balola e balo ka sutu ko fen na jambi amanke jankode so aka chelele aka sojaro le findine wala ko chele so sojaro ka tarajele e ba ta falale e taraje ninke ba fawnata e ba kelele ba fal e ba tariyate so wala na pengo kumada so ni de man pengo ferem ni ya soto jama kerama ke menna ke kendole na e busa jama be falale abe batan la bak wara e fa yo ba ne pengo ge isa soto le common collage dan just common call de ita kalam dal fang balo sikuli ado banding ni ya moy vaccine amanke nyinde ko jararolem tankarolem mo nyanta wala dunia may ko banko be pengolo don gudi sala nyimu kurande me alanko asi jamaata wora no within short time asi al balake no pour mo le courant e lanjur wora mo le fa jama ba wala ne ka vaccination niya mo tron wodo nam amanke pour mo klende injection on ni sala de ko dira niya mo vaccine isi tankande courant so men ka fo jama be je man dalilo sotal dol be ne dalilo sotal do be mo confuse kan ha sa fele fente ke mer fen mota ke men sa ko bir nga peng andung ikany mi mera den men fanan be dara binda an men pengol fanga dada wol fanga ni pengo dara ko folo jibe anyanta fabe multora fata multora so ninga mo jaay man toro soto balakando soto wala fenke ka mari tala nga rekon yaji so banko nano banko saba Gambia Liberia and Sierra Leone wol be jada kenda mol bota nyin banko sabole kafto nyoma ka fo men yalla ko biri pengu ye man toro soto ala nga jibe fo asunta nyin pengol bari tara Liberia yo lokun ke je tara Sierra Leone lokun ke je na rajam fa lokun ke jang bari men be man toro soto amang ke nyin na pengol dol be anin ku do jama anin ku do le ben exactly ani alal kirel benta woro bara amang ke vaccinote
so na jefana ka bring covid nata docteur bundal ye mol yamarol di mol nyanta tamara nyameng anu nyanta fengol men ka pour kam fan tanka say ngaje ko mol bu ko fam respect say ka masko do ke bulol ku anim fanan ku jamal bi jemi yalan ko e mol yamari wala ndala miralo kono imam pera fofu nan a contribute le me atna fo kesol be la fa kan say
I mean abe contribute la ba ne nyi masko dum amanka ko nyi aka fonyo tenten nin kuran keso be abuka futa ka dum kon hada ma de ko kuran ka dum ale nyen dundal menke kuran la nungo mo kilne de melan atele important abete so nin kuran keso na da ka dunne nyin samuta asitenta isi fonyo so kuran nyin te dunna ay sakinyen wala ma na fati hanna man kenyen covid ni ndu wate ay nafa so melan ko tambita ka hada ma de tangande kuran ma kuran nyin tare janjan na bake ya jibe nin commune kol fona ta sate kono ya jibe janin lokum saba mo jamala ka soto sa mbede mbedin sama babo dala mo jamala bin commune kol maybe dol mo dolet mena go vacciner ta maybe covid la brate batandila so ta abetara bak hada ma fana ngama fenna ntol nyim bunda mo jelle kama tilo allah bunda ja mo keme yoni mo kile mo corona la virus be bala ke o bala burma bantal amda ne karban joge fen bala mulbe kamemma jitaran fana tennem niyama mo mona da wayama da woke nyungala wala na buluko ko mara jata ke ndara na man ke covid ko mara bakele ha na adolo jama buldum rode bar ta bayno bar ni say buloko wate akte ma koy ya sanitizer is very good ala ni o be bulu wate ka amika mamante ngabara leptano le kaji telo docteur le katwa mala dron bawo ni mo jama la ka do nyole sa tolji yo ni dolbi to mando ni me bulu ko ba ni sanitizer ma sa joko kuran ke sol faale sa ko ni covid nya te bukasi ma no ni alcoholic fonko ni kon ha mi dum jeni jaka faale so amutan nun to wala tala bar sa fele mo ya bula sa cases fela bita ni aji be ni me kisi ba jola ko wala tinna mol ko masko du ne wala tinna o mol ko bulu ko wade wala tin ni tara nyin ibola keta damento o banko li tariya batal idalta bulu ko la hani sain idalta katara jama be la bulu ko lato sa ja akawol de ma bakel so mbe mol yamar la dukare alnga muru wol dol kan ni bita ka fokon masko du ni ela botlu ni so to ya bule la jibo kon ni men bulu ta ba no bar bur ni men ga do yama isa ja si balu jenko ne ko kuran ke so be fa kuran si talano wol musilo do le men kam ma koy
sa ja ngaje fanan ko adal be fongol kono kam men fo pour ko mol silande wollem ko ni man sanje tan ni sey sore manyana vaccine ni ta niata ate watira nga fe je fana sen yande
yalo vaccine ni adeda ka testle so kabiri adeda ya test because vaccine deda wanyami ni adeda ka testle and ni ba tesla testing so testing aman ke ethic pour ya start dindingol so ka start cable la so kabiri ya start cable la ya je ko cable man ku kewla cable ya protect le ko be ta kuda so vaccine roll out because emergency lo so ya roll out ba cable man ku kewla protect le so wala na vaccine di a start a cable so kabira aboto wala inata ya test ya bayo aman ku cable la jami inata ya test dinno fana bala ya jibe fo aba kukel dinno fana la ba because ka test mo dan tan bala ikam vaccine ka test jamal la ka jena ga naja so ya test dinno fana bala ya ka man kukel dinno fana la and dinno fana ba mol ko no min ya lon ko nin kurama iba waja bindika because dinno ga fit ikata banda fe ala so ni kana nin kurama sinano so yaje ko akumata pour ya test dinno fana bala ya jibe fo abadinno tankano so wala na itari ya test dinno fana bala yaje ko ya test 12 years above ya test wala fana yaje ko a safety cable to nyama a safety dinno fana do nya so wala na kabidin vaccine wala jam follow ya mi recommend wala 18 above because vaccine on test wala bala so wala tina ntol fana Gambia jantina la nganda dinno expose fenna mi alon ko aman test dinno bala so wala tina saying kabira test dinno bala ya ko it is safe a safe dinno bala ka safe ke bala nyami so wala na saying atara for 12 years mi alon ko is a vaccine town because a safety fana bala it is tested and it is effective and it is very safe
ya je ora kam I think hukuma ta ba ya long dinno lo memore fana ga covid sotale bari tolla balo katara fankar ni on de jata kende ni ke bala jata kende bakle so tolla katara bambandi na jama jama bugetul batani bari memo problem ni tar sukon imam mameje fama beje no babeje o men ke bayata ka sawndi wallema wala na din jama beje ka corona soto ka watan ni fula kata karawo dum la fang bari abuke batandi bari ni tata ka sawndi la family tolle ma so wala na jawyata bake wala na important na kiskisiro ke ka ni fasa bondi mi yalan ko be tindemol pengula ka bo sanje tan fula kata bo sanje tan sey sa im fele ngada ngasar karamu do janne ka pare karamu soranda sa e ben fe suwol ko no dukare be mul dian danila pour sa kata ba ke tindingo mo karam tindingo mo bulu sanje tan fula kata ni pengula liye moy da ba wari afale ko be tala sate wala tala sate be ba ko kamba be singolo la jere and then be mol pengula be tarla je fo montro wat ki wat fula wat sabar sa to nyinal dependa la sa to nyinal
ate nyini ka no wala fo natra mol melbe tele jibe kan sante mata folo lefta vaccine nyin tala vitamin to
si ila ariti nyinen ka so some ila tundu mansak jara kenda tundu undani ul banta dulka announce le fam ka foko mitani lunkar mita lunkar hanni ma announce baraka kila kije ka foko bi o soma bina jel mbe sama kono a wato koleta baake do ngalan do ko dol beje do ko tambinde jata kende ala bari jata kende ani mosla yaate do ko non mbe dani ro fenan kala mola ni amoy ko kar pengu labina sara do kare men man penku yesi montro wat killing wadi fula wala be sola jata kende ala pour sila ko ko do ko nya soto no so ni wanke abini batanda ni sasa ne te mati ano ko to nana ta mo jama botum wala tina ate mo kurande me alanko aka banko la fanko batande baake ni mol man ni mol me tew siti bankon dingol be jaminede da fu banko mo mo tawro wala ni sey yalla dam minister anoto sera bakale ha ayni moy bankol men kan akata kele fondo lo fotata je ka jibe wol yake nyamen bare gol comme mol le sonta mol jama mol le sonta bake wol fam kon la pour vacciner wayna ya tinna jarakinda bunda do ko lalam damma wol mela do ko nyinno habente mom be kitana pour sitra e pengo soto so mfanan comme ngola nan ka uftande banko dingol maka fo ko wala be kering banko jamal be je sanje mo 78% 79% dol be je siara wa Rwanda nyol no be mo kilonati amen be Africa jang pengo kilonlem beti amen so ni wala yake no mfanan sa ke no ta ko nga banko tankandi saje ngada mo jama sita ni skardan dan kono jang ko bring mol batata mol sita do ku manke fim bang yala o manke banko la karat so du nimma hakilo namuta nang naja o jabda fana fo e dlal soron ko rek so pour ka mba wala nga fengo ta do nana ta kurang abe nyinel na mo moja alon ko nyimpengo da dunna ta ku kele la finda ta la hajo na me da banko ka fintiten kurang tro ka kurang nyintune ka trofa sila ta je fo ke pengo rek inshallah.
All right, sign left al pour nga kening surwa kan la fana malong ening Mr. Jaite ba summarize la just briefly ce que ma anglais kan mo ening man ka ko iba try la
no you summarize
kon mbokk yi ba tey ñu fa programme bi nag ñu ko dooleel ak ñi nga xamantene ñoo ko dépense mooy Ministry of Health mooy jawim biñ denk wàllum wér gu yaram ci réew mi ak ñi nga xamantene la ñoo liggéeyal mooy seen partnership programme bi nag li ko tax a jóg mooy waxtaan ak askan gi ci li nga xamantene moo ajoog wàllum COVID-19 xam nañ ne Covid ba tey mu ngi fi dégg ngeen ci kii di Mr. Omar Jaite ak kii di Mr. Sidat Fofana mi nga xamante ne ñu ngi bàyyi ko ci Ministry of Health wax nañu ne jamono ji COVID-19 mu ngi yokkuwaat ci réew mi loolu waral nag ministry bi jóg nañ indiwaat beneen campagne di gën a ñaax nit ñi ñu gën a jël vaccine si ndax ñu mën a aar seen boppa aar yi tamit seen njaboot ci biir loolu tamit nag ñuy wax ne campagne bi door na te jubluwaay bi mooy ci weeru décembre mu fekk ne lu war a toll ci juróom-ñaari xaaj yëpp ci li nga xamante ne mooy askan gi wala réew mi ñëpp nañ am li nga xamante ne moo di vaccine bi ci jamono boobu leen nga xam ne dina óor pour ñu mun a delluwaat di dunda comme lu ñu daan dundee kon ñuy ñaax di ñaan ñëpp fu waaye munti nekk nga génn dem jël li nga xamante ne moo di Covid vaccine yi su fekkee jëlaguloo ko ñu ngi leen a ñaan loolu leen Otto just quickly again in case for those who are just joining us, this program is being brought to you courtesy of the Ministry of Health, and it's about the new COVID-19 vaccination campaign that the ministry is rolling out again. This is the fourth one, I believe, since the emergence of COVID in this country. So let me go back to Mr. Jaite again. From what period to what period is this campaign going to last?
Yes, the campaign is a 10 days campaign. So we'll be the campaign will be going up to on the 20th. So it's a 10 days campaign where we have our gallant public health officers in the field. They will be going from community to community. They will be going from street to street. Yeah. They will be targeting your Bantabasi, your schools, ferry crossing points. They will be targeting you there. So you will see them in your community within these 10 days. Yeah. Yes, it's a 10 days campaign, and it's a vigorous one. So the ministry is expecting everyone who hasn't yet taken the vaccines to come out. And some will also ask whether pregnant women can take vaccines. Yeah. It is very safe for them. Okay. They can take it like it is safe to them like others. So they can come out in full. Children from 12 years. So it is very safe. So they can come out and take this vaccine within this 10 days. Okay. So it will end on the 20th. Yes.
All right. Yes, Mr. Jaite?
I think that is important that people know that. This is something is trying to protect lives of Gambians from dying and from a preventable disease, a vaccine preventable disease. And the repercussion we all know, where the coverage is not high, there is always the disease always go up. These two are inversely proportionate. When you have low coverage, the cases normally of that type of disease will always go up. If you have high coverage, they come down. So that's the present situation that we are in this country. Our coverage is not very good. We are trying, definitely, especially the women of folk of this country. And I want to remind everybody that now this vaccine is a passport.
Yes.
You cannot enter somebody's country without this COVID certificate. And as Omar alluded to here, you vaccinate, you wait for 14 days before your certificate can be issued to you. And then we know people will just come and travel because they know they are traveling. Tomorrow they come, they want their certificate. That is not going to be possible. Some people will travel up to certain places and they wake us at very late, very odd times. I'm so and so airport, please. They said I need COVID certificate. I mean, we can't.
Yes. Yeah, but initially when you take the vaccination, you're given your certificate almost immediately. I remember when I took mine, I received my certificate.
Yeah, but now there is a new one now. That is, how do you call it?
QR code.
QR coded.
Okay.
You take it and they scan it. The airport authorities will scan it and they look at your vaccine.
They will verify.
To ascertain, So without that, you are in trouble. And now I have seen some people, you know, funny type Sarahules. They always do last minute and they always don't want to waste time. That is not possible. If you want to travel, even if you don't want to travel, take this vaccine. After 14 days, you come for your certificate, you keep it, because you don't know.
I think this is an important point, and I want you to do this in the local language as well.
Yes.
So people
exactly. Certificate, pengoni niata, tiltan nan kola, isila QR code certificate. Nka certificate di la green one, bare wubuka finde banda. Sa in dunia be menta, wala isi pengu, nintiltan ni nan sira nan dola office EPI code, be QR code certificate di la. Dunia be ko ni mo society terminal lato. So akumata bake. Lunga mo jaman so mela kana ni ala ko sini libeta mala yana fo bil suni nen kada alim mako ala certificate dai kambara dina office ko bag bara buka keno nya masngi nyam buka sonna ba pengoni nana fa findire balo kono tiltani nana o satara budo istano dawda le temo sound so waya kum mande bake pour mol sina yele vaccine ta ya juna ni nyim mol frema don ata ni green certificate on ndila ta after 14 days era EPI ya fo ko ngani talen to bukan ngar kada lo ngadila num amang ke ko men dada network olam so suto dol kata male bakade buke fam batandala ni ta bar sa fam alhamdulillah e aporo jang ite tunna pleno ko ni mo ila certificate ita yo bar budo memo problem yana bi ko ngadila bi masin men kada system wala internet system wala man ken dolti abuka song so mbe danro kala mo la sew kalamata ba pro isaje kana kola kusuro ni la fata amala
again, Mr. Jaiti, I would want you to still emphasize this, the importance of taking the vaccines.
Yes, taking these vaccines are very important. These vaccines, they are like other vaccines that that have been given. In the Gambia, we are known for that routine immunization, and we have very success stories in it. We are given measles, we are given yellow fever, we are given so many vaccines, meningitis.
Different vaccines.
So different vaccines that are given to mothers, children. So it's the same vaccine. It's for the same purpose, and it's the same people giving this vaccine. So the people that you are not doubting for more than 50 years now, and within these two years,
why should they have 2 months?
Yes. So that trust has to be there.
Exactly.
So these vaccines are very, very important. If you take them, you are protecting yourself, and even if you have COVID, yes, people can argue that if you take the vaccines, you will have COVID. Yes, you can have COVID if you take the vaccines, but your probability is having it is lower than someone who don't have vaccine. And if you have the vaccine, you are likely to have only mild symptoms if you have. Yes, if you have symptoms, it is likely to be very, very mild ones. So those who don't take the vaccines, if they have the virus, the probability of them having very drastic symptoms is very high. So that is why these vaccines are very important. They are very, very important. And for those who are at our homes, those who have other comorbidities, these vaccines will not only protect you, but you are protecting them. You are protecting the community. You are protecting the whole Gambia, because as we said, we are targeting that 70% mark. So if we don't reach that 70% mark, we are still behind. We are still not protected. So at least if you reach that 70% mark, that 30% there can be protected through the herd immunity. So that is why it is very, very important for us to come out and take these very important vaccines that we are rolling out across the country.
I think add on to this, coverage, if you have a high coverage, and when it's very good for our tourism, because most of these tourists in Europe, they are covered by their insurance, life insurance. So if you want to visit a country where the vaccine coverage is not high, they'll tell you, they will warn you against going to that country. Yeah. So that has affected us, and it will continue to affect us. And
our economy relies on
exactly. Young people will go and get employed at the tourist. I mean, it is employing a lot of youths. Yeah. So, but it's going to be on condition that the coming of the tourists is going to be on condition that we have high coverage. 18% is very low. Only tourists who don't give a damn or who will go against the advice of their insurance companies will definitely travel to the Gambia. But those, most of them will not. Even their citizens, their government will not allow them. So it is very important for this country to get high routine immunization coverage, and we are known for it. If the women are doing it now, even as I said, the women for coverage for COVID, their coverage is higher than men. What are we waiting? I mean, we are the breadwinners. When we die, it affects a whole family. It affects the whole family. So if government is out and its partner to help us, I think this is I don't think this should be any important point of discussion at any level now. Everybody should know that this is there to protect us. All the rumors were false, and then we need to forge ahead. And there is no shortcut. We must be vaccinated to protect this country, to protect the world population from COVID-19. That's the only way we can get rid of it. The disease can die. If it doesn't have anybody to attack, it will die. So like other diseases that are eradicated in this world, we have eradicated polio. Smallpox is eradicated. And for this country, a lot of these vaccine-preventable diseases, I have never seen somebody with polio. I'm almost 30 years in the service. So that is an indication that vaccination against some of these diseases will protect them. And in the long run, they will all die. That's it.
And I know the ministry have rolled out, 3 campaigns in the past. This is the 4th one. But I think this one couldn't have come at a better time.
Honestly.
We're in the rainy season. I mean, we're experiencing flooding, malaria,
other diseases are surging.
This, for me, is quite timely.
It's timely. Yes. It cannot be overemphasized. I mean, Africa is ravaged with a lot of diseases. But any disease that is able to come out and people are able to come out with vaccination, I think that is important. So to reduce the burden of these diseases that are killing us in Africa, the only thing is, we try to prevent them. Vaccination, and that's the most cost-effective one. Vaccination cannot be compared to any human intervention in the world, apart from the provision of wholesome water to millions of the population. But apart from that, vaccination is the most cost-effective public intervention that has been known to prevent some of these dangerous diseases that have been rampaging the world since civilization started, even before that. So it is important. That's why it's beyond imagination. You see somebody trying to tell people don't take this vaccination, and they will not be able to give any good reason. They will not give you any scientific reason. Anything that will all be on lies. I think so. I had. Now we have seen so many people will call us. Please, my mother is so and so, he's coming from Europe. Before there was some people who were advising their people, but when they were sure that this is something, and they were advising their people to come and take the vaccine. Still, even now, people will call me at night, say, my mother is so and so, and I give my sister, he's going to bring my old mother. Because those people know, they are aware. So it's only people who don't know, just people who just want to bring confusion. We can have differences in our religion, in our values, in our practices, no problem. But when it comes to protecting the population, especially through such intervention, I think that's something that is very important. That's worthwhile.
Vaccines, as he said, they are very, very important. As I said earlier, we have been using vaccines a long time. And vaccines, they did not only protect you, but they save the health system. They also protect the health system. Because as he said, it reduced the burden on the clinic, on our hospitals. Because if you see that today, it is very, very rare to see diseases like measles, diseases like polio, diseases like meningitis. To see them is rare. Tetanus, those ones is because of vaccines. So, if you imagine with that diseases around, how our health systems will be, they will be really, really struggling to deal with them. So. That is the same strategy that the ministry is using. The same strategy they use against those diseases is the same one they are using against COVID-19. So if you take these vaccines, you are also helping the government. You are also helping the doctor there at the hospital. You are helping the nurse there at the man clinic, struggling with the patients. You are reducing the burden on them. So that is the good thing about taking vaccines. If you take these vaccines, you make yourself part of that people that is helping the country move forward.
Indeed, we have about 10 minutes, and I would want us to focus more on this new campaign. You know,
let me comment there. I think that is important. As we have been saying, it's a 10-day campaign, and then vaccinators will go to every community. If they don't reach your community this time around, maybe next month, because we want to do it monthly.
Okay.
And now we have the rains around, and I know some people, but this around, you know, this region sometimes will always shy away from rains, you know. But I don't think that should be a factor now. Let's put on our rain boots, let's put on our umbrellas, our raincoats, and make sure that if the vaccinators are at your community, they have people who will go around those compounds and try to inform everybody. So nobody has an excuse. The importance of protecting oneself and your family cannot be overemphasized in this program. It cannot be emphasized at all. So please, we appeal to Gambians. I mean, partners are there. World Bank is supporting very well. WHO is supporting very well. UNICEF is supporting. IMO is also supporting the Gambia Red Cross. These are all people who are, putting their resources, human resource, monetary-wise and so on, try to make sure that we are also protect. All countries are doing the same thing. So we should not allow people to go up, especially in our sub-region, when definitely we are lacking at 18%. It's a serious. It's
quite
problem.
low, really.
The population is very small. 2 million is not difficult. If people want definitely take, are interested. Within 1 week, we should be able to. we should be able to.
Indeed.
A country like India will vaccinate 70 million a day. I mean, Gambia 2 million should not be a problem. So it's all towards public good. I say so that all this money, all these people, we have lost a lot of very important, very prominent people.
Absolutely.
In fact, some of them are our colleagues, very important to the nation. But because of COVID, they got COVID, and they died. We cannot save them. So that's what we don't want to happen, to see in this country anymore. For anybody. Nobody has an excuse. Government is going all out to make sure that people are given whatever they need to, so that we protect, we stay as a very healthy country, to make sure that we push our economy, our education, and even this Mecca thing, the religious wise. Mecca did not hold for the last 2 years. That's one of the worst things that can happen. Likewise, Rome.
Pilgrims was drastically reduced.
Drastically reduced. So these are things that will continue to affect us. Saudi will not allow us to go if our coverage is not. Look at this, the number. I mean, it's below the usual number that they normally allow for the Gambia. And most countries, but some countries, they allow them to take as many people as they want because they are protected. Saudi is very concerned about the public health, the health of the population.
Absolutely.
That is why you cannot go to Saudi without meningitis vaccination. And you cannot go to Saudi without yellow fever. They are protected. They want to protect their country. Because all these people are going there. If they are not protected, they are going to leave the disease with them. So this is just common sense, I think.
Jaita, again, on the campaign, I know he's mentioned that there is intention to extend, to at least have it monthly. But for this one, from what period to period, again, just to remind us and where we can get the vaccines as well.
Yes. The campaign has started on Thursday, on the 10th. So it will end on the 28th. So it's a 10 days campaign. Will be around the country. Will be we'll be targeting bantabas, schools, health centers, So we will be targeting all these places. We have over 400,000 doses that are lying there, and they are waiting for us to take them to protect ourselves. So I think there cannot be a better time than the time we are.
Absolutely.
Yes, for the Gambian people to come out and take these vaccines, because it's for the greater good of them and for the greater good of the country. Yeah. So it is from Thursday and up to on the 28th this month. So it's a campaign, and you will see us at your end.
And the issue of age as well?
Yeah, the age is from 12 years and above, and especially the students that have taken the first dose.
Yes.
So we are really advising them that the same team will be coming around you, and so you can go there to get your second jab. And for those who want to travel, it's a right time for you to get this vaccine. Yes. Because if you don't get it, if you want that urgent thing, it cannot happen. So it's a right time now for you to go and take these vaccines. And if you want to change your card to the QR code card,
I was going to ask about that.
Yes, you can.
I remember when I took mine. This was last year.
So you can take yours to EPI at Kodu here. So they will change it into a QR code.
Your passport,
so that one is verifiable anywhere in the world. Yes. So that is the good.
The moment they scan it, they'll see all your vaccines, the dates you've taken them, where you've taken them.
Okay.
So that will show those authorities that definitely you are protected. So without that, now you don't pass.
You don't travel. Exactly.
You don't pass. You can have it in your phone and move it with anywhere. So that's the situation now. Please,
again, yes, on the issue of the misconceptions as well, that have really contributed to the vaccine hesitancy that we experience.
Yeah, definitely. That has hampered us sometime. But definitely this last round, we have seen tremendous achievement. Yes, 120,000 out of these 10 days. So that is big achievement, and we want to thank all Gambians for that. We want this to be replicated in every round. This round we may see maybe 200,000, the next round. So it's not difficult. The most difficult thing is when there are no resources, but the resources are not in short supply. Our partners are all waiting to make sure that we push our immunization coverage up, and then it's for us also to now to take it. This is simple. I don't see any reason why we should not be there even well before December. And after 2 months, we can vaccinate the whole population of this country. Absolutely.
I'm being notified that we've run out of time, but I mean, it was a pleasure having you both here, of course, to talk about this new campaign, that COVID vaccine campaign that the ministry is rolling out again. And we encourage all of you out there to take advantage of this campaign. Go out there, get vaccinated, protect yourself and protect your families. We'll just also remind you that tomorrow, officials from the Ministry of Health would be here again the same time to talk to you about this new campaign. Jaite and Mr. Fofana, we're very much happy to have you here, and we look forward to engaging you more in subsequent programs.
I appreciate it.
All right, thank you.
Thank you.
It's all that we have time for. Thank you.
Thank you.